diagnose you. An A1C above 6.5. Fasting glucose is over 126. That will diagnose it. 2-hour blood glucose greater than 200 during an oral glucose tolerance test. We really don't see these kind of lab tests done except for pregnant women, where we're trying to rule out gestational diabetes. And then a random glucose over 200. So just middle of the day, you come in, you have a doctor's appointment, they do a blood sugar, and you say, I've been feeling pretty tired and thirsty lately, or, other symptoms of high blood sugar, which we will go over. And that whole picture together can diagnose you without a fasting blood. People who are diagnosed with prediabetes, they really should be referred for dietary counseling and maybe some lifestyle counseling to, again, delay or flat out avoid getting diabetes. This is what goes on with normal functioning in a non-diabetic. So here's glucose floating around outside all the cells, and in this case, it's floating around. The insulin hooks up with a receptor, and it's doing that so that it can get the glucose to come into the cell through these receptor doors. There it goes. So, if you have adequate amounts of insulin, in this case you see lots of little green circles denoting all this insulin that this person has, and if the cells are working properly in that the insulin and the receptors are getting together well and doing what they need to do in order to allow the glucose to get in, that's kind of a perfect picture in terms of metabolism. You see type 2 diabetes. So here you have a cell. You got plenty of glucose outside, you got plenty of insulin floating around, and boy, that glucose would like to come in and fuel that cell. But look what happens. This is what we call insulin resistance, where the cell is resistant to the insulin. This is the result, where you have insulin resistance at the cellular level. And so look what happens when the glucose tries to get into the cell. You really can't. You get a couple, there you go, 2 out of how many? So here's a cell that's basically starved for some fuel. And all that sugar or glucose, the yellow circles, are hanging out there in the periphery. Before meals, 80 to 130. After meals, the blood sugar typically goes up about 2 hours, 90 minutes to 2 hours after starting. And it may go up about 50 points. So if you're starting at 130, it might go as high as 180. At bedtime, the goals are 110 to 150. So why does blood glucose matter? Well, to reduce the short-term symptoms of high blood glucose value. The other reason is simply to reduce long-term complications.
Yes, we do have a question. Is it better to eat your biggest meal in the middle of the day, or when should you eat it, or should you kind of have them all equal?
I'm not super rigid about that. I would say, first of all, I think your carbohydrates, and probably all your food, but carbohydrates particularly, should be distributed well over the day. I discourage having a huge dinner like some people do, and they eat very little at lunch and breakfast. If you were to have a bigger dinner than the others, lunch would be a good one to do it, because you have time during the day to kind of work it off with activity, assuming that you're active in the afternoon. Evenings, people tend to be a little bit more sedentary, watching TV, reading a book, whatever. We're tired in the evening and may not have the energy to work off dinner like we would lunch.
You hear all these claims about cinnamon and ginger being of help to diabetics. How would you rate those as a homeopathic remedy?
You can't do wrong by cinnamon. I always say when the ADA supports it, then that's a pretty good sign that it must be doing something good. Maybe you can speak more as a dietitian, but I think that cinnamon, I think we've had a fair amount of data out there to support that it can be beneficial, particularly to type 2 people. The ginger, I don't know. I don't know what the latest is on ginger, to be honest with you. I haven't seen anything that's jumping out at me about helping with blood glucose or insulin sensitivity. Have you, Joyce, seen anything?
No, there have been more studies with cinnamon and the benefits of blood glucose, but I have to say that the best evidence-based studies still aren't showing us that cinnamon should be, for homeopathic remedy or treatment, yes, maybe somewhat helpful, but it doesn't replace medication, and increased activity and just good healthy eating. What I say about cinnamon is it's a great spice to use, and it's certainly not going to do anything detrimental to your blood glucose. So if you like cinnamon, use all you want. Ginger, same thing. Neither of them are going to be detrimental to.
The last slide just says, how do you manage your diabetes? It's a combination of medication, nutrition, which includes weight control, exercise, and stress management.